Hi everybody, welcome to my talk today, Support Structures for Newly Registered Nurses and Nursing Associates. I work with a lot of new starters who worry about that transition period. So this really is for you, this session, so that it reassures you about the support that's out there. There's also many terms that are used like clinical supervision, preceptorship. We've got new roles in England, professional nurse advocates. What do these terms mean? So a very simple overview and giving you lots of tips about how to identify communication structures and team structures that you're going to have to navigate. I will do some future videos in more depth on certain topics in this session, but it's very much an overview, and I hope it helps, and I hope you enjoyed the talk. If you do, give me a thumbs up and do subscribe to my YouTube channel with lots of other free videos if you're interested. So I'm going to give you an overview of key structures of support for newly registered nurses and nursing associates, key tips to help you access support. Also, if you're looking at applying for your first role, there'll be lots of content in this session and that you might want to think about when you're exploring which role to take. It might help you decide. It can also help with the expectations, so you can ask what's available for you, how are they going to support you if you know what sort of structures are out there nationally. I do have a video on choosing your first nursing post with lots of tips as well, if you're interested. So first key thing is to identify key people, and initially when you start you'll link to your line manager, you'll get your offer letter, and the line manager will be part of a clinical management and leadership team, or it could be a research role, but whichever role that you go for there'll be a leadership and management team. How big or wide that team is dependent really on the employer. Wherever you work, there'll also be a clinical education team, somebody responsible for your professional development and your education. And large NHS trusts and community trusts and institutions usually have a corporate education team, and but smaller employers still have to monitor and provide professional development and training to ensure that all their staff meet legislative and professional requirements. So it's helpful to find out about that structure. Also, peer support. So all newly registered nurses should be offered clinical supervision, a preceptor, and I'll talk about what clinical supervision is and preceptorship is on some later slides. You might have career advisors who will do career conversations, and we have new terms coming out such as professional nurse advocate role that's currently being evaluated by Health Education England, legacy nurses, and there may be localised support groups, and there'll also be a local team, multi-professional medical nursing, allied health professional team that is there to support you. Clinical governance leads and safeguarding leads, specialist nurses, clinical nurse specialists or advanced nurse practitioners, lecturer practitioners and consultant roles. So there's all this wealth of knowledge and experience that you can tap into as a newly registered nurse or nursing associate. Health and wellbeing is very important, and the support available I'll talk through, and human resources, freedom to speak up guardians, and occupational health, and as I said, wellbeing support. There's also national support groups, so you've got the Royal College of Nursing has lots of professional information on its websites, Nursing and Midwifery Council, NHS departments and the nursing unions. So what do you need to know when you first start? There's two aspects, I think. It's what the roles and responsibilities of the key staff, the teams and the services are linked to your role. So who do I go to for support if I need help? Or if I'm struggling, how do I professionally develop and progress in the role? And that's where you'll be linking to that organisational and leadership structure and educational structure. And that's why it's very important to find out who's responsible, and if they're not supporting you, who do you escalate it to, who do you go up to, or if somebody's off sick, for example. So knowing about the whole structure rather than just one person that you're linking to. You usually have a 6 months probationary period. You might have some role specific newly registered nurse or nursing associate competencies or proficiencies to be signed off. Not always. There may be SMART goals that they ask you to write, but it will link to your professional development reviews, which I'll talk about. You usually have a supernumerary period where you're not in the rota numbers. There is no set national guidance on supernumerary because it depends on the service. So, for example, somebody going to a neuro an intensive care unit may have 12 weeks, 8 to 12 weeks supernumerary, due to the nature of the skills that they're applying and the knowledge that they require. Somebody on a hospital ward might have 3 weeks, 2 to 3 weeks, and then a week where they're supernumerary, where they're working alongside staff. And supernumerary periods can be structured in different ways, where within 1 week you're supernumerary, but you're out clinical, based in a community setting, working alongside community nurses, district nurses, for example. It just depends on your role. So knowing the roles and responsibilities is important. Also knowing the roles and responsibilities of the allied health professionals and services around your role, and the roles of support workers up to registered nurse or nursing associate. It helps you with delegation. The second thing is how key information is communicated between staff, teams and services. So where do I find that important update? Where is the clinical governance safeguarding information? Where are educational, networking and career opportunities advertised? So looking at key roles and responsibilities, names and contact details, you could just write a list when you first start, but looking at the employer intranet, is there any helpful visual representations? Often they've got diagrams, say for example, for organisational structures, and it's worth downloading them and having some key names in your folder. Or on your computer, and also on the internet you'll have explanation of services and departments, and increasing your understanding of those roles and responsibilities. Don't be afraid to introduce yourself and talk to staff when you first start. I've got a video on differences between support worker role, the nursing associate and registered nurse, for anybody that's working with support workers, so do check that out as well. How is information communicated? So is it the intranet? Is it face-to-face meetings? So do they have regular unit meetings, ward meetings, community meetings? If you don't go to those meetings, usually there are agenda items that you can send to that meeting if you can't make it, and there's minutes usually written up. So it's helpful for you to keep in touch with communications, finding out how information is disseminated essentially. Also emails. Is there a comms team, a communication team that sends out generic emails, or does the unit manager or your line manager do this? Is there an actual communication board where flyers are put up, for example? So many areas have clinical education boards, for example, where I work, so they may put flyers up for interesting education study days. It might go on email, but also be on a board in a handover room or in a quiet coffee room, for example, for staff to view. Then you've also got local and national policies, guidelines, standards, risk assessment, deprivation of liberty safeguards may change to future liberty protection safeguards. There's updates on national websites and on social media. So if you link to national institutions, you'll see those updates coming out. So social media as well is very good to link to with certain institutions as well. Looking at your professional development, so if we look at you coming in as a new starter, you will start with an induction and an orientation program. So as a new a student nurse or a trainee nursing associate, if you're deciding where to go for jobs, don't be afraid to ask for those packs. You could ask line managers to send you them on email, or if there's an education team, you might be able to link to find out what preceptorship programme looks like. And there'll be learning resources potentially linked to your area and where you're working. Supernumerary time. If you are struggling, do not hesitate to talk to somebody, and you can get supernumerary time potentially extended and have some additional support and have some plans for support, additional support to help you. You'll have a preceptor to oversee your progress and support, and I'll talk about preceptorship a bit more detail, but also that preceptor may not work with you necessarily on every shift and by your side on, you know, they might do if you're lucky, but often they will oversee your professional development. So they might review your professional development plans or your reviews, or they may get buddies or mentors to do that and to feed back to them how you're progressing. If you've got a team leader, for example, they might be a preceptor and they might ask the rest of the team to support you and to feedback on your progress. There should be professional development plans and reviews in place, and different employers will have different packs and structures. But as students and trainee nursing associates, you're used to being assessed, looking at proficiencies, for example, the NMC proficiencies. So similarly, you know, it's not going to be hard. You'll have goals set or competencies to look at, or learning outcomes depending on the area. And I have got a video on aims, objectives and SMART goals if you are being asked to write some, so do check out that video. And also appraisals that are annual usually. So if we look at preceptorship and what the essence of preceptorship is, the Department of Health in 2010 and the Nursing and Midwifery Council in 2008, the Royal College of Midwives in 2017 advised that all newly qualified nurses and midwives should have a period of structured preceptorship on registration. So what does that mean? It's essentially the preceptor facilitates the preceptee, that's you, the new starter, knowledge, skills and confidence in practice, and the preceptor must be a registered healthcare professional. In 2022, the Health Education England project with Desiree, I hope I've pronounced that properly, Desiree Cox and Dr. Jane Ray launched a new national preceptorship framework in England for guiding employers. So you can find that online. And prior to that, Capital Nurse developed a preceptorship framework across London, providing best standards of practice with agreed protected time for preceptorship support. Now, preceptorship periods have varied across employers, but all the 4 nation NHS educational departments are looking at, you know, a framework for good standards that employers should be aspiring to, essentially. So you should be trying to find out about your preceptorship and what's available prior to taking a job, I would suggest. In Scotland, we have NHS Education for Scotland, and they had in place already a Flying Start NHS national work-based learning programme that complements preceptorship. And looking on the website, for preceptorship, a line manager will be responsible for supporting newly registered nurses to complete the programme. In Scotland, preceptorship's defined as additional support and guidance offered during the registered nurse transition period, and the recommendation for time is no less than 6 months and no more than 18 months in Scotland. So it's interesting to look at the different frameworks across the 4 nations. So these frameworks can change. They may change at any time in any of our 4 nations. So this is currently November 2022. But in Scotland, they link preceptorship to an induction, which is like the slide I presented earlier with orientation, and Flying Start NHS, and then professional development plans. And if we go on to, So the Chief Nursing Officer in Wales is currently working on a vision for nationally consistent preceptorship for newly registered nurses. And interestingly, this is being linked to a framework of clinical supervision, because it shouldn't just stop after preceptorship. We should have this lifelong learning of clinical supervision and support. And similarly, Northern Ireland Practice and Education Council for Nursing and Midwifery, they have a preceptorship framework that's been updated in 2022, and that's also to align with their reflective supervision framework. Looking at the preceptorship framework in Northern Ireland, again, it says lasting a minimum of 6 months for preceptorship period, and there should be a minimum of 2 learning opportunities a month. So the frameworks are all slightly different, but essentially the message is out there that you should have that support on transition. There should be professional development plans, you should have an orientation, and there should be some structure to your preceptorship and learning. So watch this space. This is, as I said, November 2022, so there may be changes in the future, because nursing is continually evolving. So another term you'll hear is clinical supervision, and it can be some conflicts and different views really on what clinical supervision is by different nurses. As a clinical supervisor, I keep my clinical supervision sessions very open to what that person, what's going to benefit that supervisee. But essentially, it's a formal process of learning and professional support using a non-judgmental support. So I'm not there to judge that person, I'm there to support them. And the relationship between the supervisor and the supervisee, the person being supervised, it's about facilitating reflective learning, and that's the essence of clinical supervision. It should provide a safe and confidential environment to reflect on practice and discussing issues important to the supervisee. Now, you'll see different terms, so the CQC, and I've seen different definitions of clinical supervision, and people might talk of professional supervision, where you and their definition of that might be that you're in a clinical area and you're working with a staff member and you are professionally supervising, maybe reflecting, but you can't be confidential necessarily if you're with a patient in that area. Clinical supervision sessions I offer to new starters, for example, or any level of staff, would be in a closed confidential room. So there's different terms that can be interchangeably used across the literature, but I would say that as a new starter, to find a clinical supervisor during your first year and throughout your career is helpful, when you can go away from the clinical area and reflect on your practice and in a confidential, trusting relationship. So for me, clinical supervision sessions, there should be reflection. There has to be trust between the supervisor and the supervisee. There needs to be listening, so you have to have listening skills to listen as a supervisor, and there needs to be support and reassurance. It facilitates, the essence to me is facilitating a reframing of thoughts and learning that either promotes well-being or satisfaction. It helps develop that person's confidence, and to retain that staff member in that role, they need to be happy and healthy with their well-being and their mental health, and so supervisory sessions hopefully will help that person, and it's all individual to the needs that they have. So there's several models and terms of professional supervision. As I said, they can be used interchangeably, and a lot of people talk about Proctor's work. There's a reference there if you're interested, and he talks about, or she, sorry, it's Bridget Proctor, I think, normative, restorative and formative clinical supervision. And the example I just gave sort of links to that. Normative is more about management, leadership, the organisational standards and values, and where I might bring that in is if somebody was talking about clinical governance, or an issue that links to evidence-based practice, or the way someone spoke to them, you might bring in some values and organisational standards. Some people will have clinical supervision that's very much directed about what the employer wants, and it's much more structured. Clinical supervision, for example, that where you're letting the person reflect is different, I think, but I think they're interrelated essentially. Often when I do clinical supervision, but everyone comes with different views. Restorative, Proctor talked about interpersonal support and dealing with challenges, and I keep my sessions very open so people can just come and talk about whatever they want, really. And then formative is that learning, the reflection should take you somewhere where you're reframing your thoughts and you're coming out with a slightly different view because you've reflected on that issue with somebody that's experienced and that is listening to you in that safe space. And then there may be further development, and so the next session we might come back and have some ideas for how they may self-direct some learning or access additional support. So if they needed some extra wellbeing support, or it needed some additional counselling, for example, I wouldn't offer the counselling. I would have to refer on to counselling services, but you're there as a support to signpost people as well, potentially. Another role is the professional nurse advocate, and Health Education England are currently evaluating this new role. A professional nurse advocate are qualified practicing nurses who have undertaken a level 7, which is currently a master's, PNA, a professional nurse advocate accredited programme, and it's structured on this A-equip model, advocating for education and quality improvement. And Health Education England are providing this training programme currently so that professional nurse advocates can facilitate restorative supervision. So from the previous slide, you'll have a bit more insight into restorative supervision to their colleagues. So it's linked to clinical supervision, which is why I've put this role up. And then we've also got a legacy nurse, and Norfolk and Waverley Health and Care Partnership evaluated the introduction of this new role. And it's an interesting role because I'm coming to the end of my career. Providing professional advice, drawing upon somebody's lengthy career so that they can offer real-time support through clinical supervision and coaching provided to students and to colleagues working alongside them in practice. It'll be interesting for you to see, are there any of these roles out there in the future? If these roles are evaluated well and they have impact, they may very well be rolled out. And it might be that you think about creating going on one of this teaching to become one of these roles in the future. So coaching, I am asked about what's the difference between coaching and clinical supervision. The main aim of coaching is to improve your performance at work or in life. You can have life coaching, but coaching usually lasts for a shorter period. So you have a defined coaching series of coaching sessions, usually 3 to 8 sessions, and it focuses on specific skills or targets or career objectives and goals, for example, or professional objectives. It can differ. Some people have much longer periods of coaching and they might want to stay with that coach for the rest of their career. It's usually more short term though, where a trained coach helps you understand a situation more clearly and develop new ideas and to take future action. And employers are not obliged to offer individual coaching. You usually have to pay for it, and there's a lot of private companies out there that offer coaching. As I mentioned earlier, you've got your educational professional development training with academic courses. So initially you're starting with induction, orientation programs. You're going to have a preceptorship framework. In Scotland, you've got Flying Start. In the other 3 nations, you will have a preceptorship framework and guidance. Then you have specialist study days, programs, conference days that you potentially can apply for. And Then it's looking at university modules, courses, academic courses, and I have got some videos with much more detail on of which post-registration courses are out there, how to access funding, and some top tips if you're applying for charitable funding or external funding and grants, for example. Professional education and academic courses such as student leadership programme, post-registration specialist courses. There's masters linked to healthcare leadership, there's the Leadership Academy and Florence Nightingale Foundation scholarships, and different masters in advanced practice, education, leadership, for example. So looking at your health and well-being is essential, and there are departments such as occupational health. They offer wide-ranging health and well-being advice, from anything from skincare, looking at risk assessments, advice on reasonable adjustments, and they can refer to psychology and counselling services, for example. You've also got human resources and freedom to speak up guardians, and they support physical, emotional needs of our staff. You can speak confidentially and they will advise you and link you to the wellbeing team, or just give you some advice on whatever issue that you bring to them, but it's confidential if you ask it to be confidential. There's the Employee Assistance Programme, offers financial advice and guidance. So there's sympathetic, it's non-judgmental support, and it's also a place to support you with money worries. So financial support for nurses, there are affordable loans that you can be repaid through salary, for example, if you want to pay a credit card off at much lower rates. There's also something called advanced earned pay. So you've got the ability to access some of your salary ahead of your regular payday if you're becoming into financial difficulty. There's employee discounts, and so it's definitely worth linking with human resources and freedom to speak up guardians who can advise you, and then you've got the employee assistance programme. Looking at self-management, the Shiny Minds is a free app for all NHS nurses, midwives and healthcare support worker, and it's different to other wellbeing apps because it was co-produced with nurses, and it sends like everyday inspiring messages, positive thinking, gets you to check your emotions and share your thoughts, and there's masterclasses on the app on sleep, self-compassion, a gratitude board, and it's about creating positive habits and a mindset with the app. And I've downloaded it and I'm using it currently, and I found it very helpful. There's also national networks, so you've got the unions, sort of a variety of unions that you can join. There's social media, you can, and Facebook groups and Twitter groups, the Royal College of Nursing Newly Registered Nurse Network, for example. And then there's more specialist support groups, and I recently did a talk at the Young and Early Career Cancer Nurses conferences, and they're a wonderful group of really engaging new starter early career nurses in that specialist area and supporting them and inspiring them, and they recently had a conference that I spoke at. But there's other specialist support groups for early career nurses, so try and find out what there is in your specialist area. The Cavell Nurses Trust is a national UK charity giving money and support to nurses, midwives and healthcare assistants who are facing personal or financial crisis. My final message is please, please, please speak up if you're struggling. Always talk to someone if you're struggling. Look out for other people as well, because you might be okay, but someone else might not. Access the available support that's out there. I talked about the line management structure at the beginning and educational structure. Start there. If your manager's off sick, go to the next person that's available. Escalate if you are not receiving that support, and do your research when choosing future roles. It's not to the employer's benefit not to support you, because if they don't support you, you have the option with the vacancies we've got currently to go, and staff will leave if they don't feel supported. So, but hopefully some of what I've covered today will give you some insight of what you need to be looking for. I've got some other videos out there if there is on some top tips for supporting you during your first year, looking at career progression, decision making, and some videos on career pathways as well if you're you're interested. And do put any comments or questions in the YouTube comments. I'm very happy to answer DMs if you just link to me on Twitter or Instagram, if you prefer not to put it in a public forum. Very happy to answer questions. I wish you every success in your role, and you will be going out in the future in your career, and it might be that you are the change that you see, and you look back on this talk and think, actually we need more clinical supervision, and that you might be the person that sets up a support network for nursing associates in your trust, for example. So be that change as well. But I hope it's helped you out, any of you out there.